Hello ladies and gentlemen, boys and girls, welcome to my YouTube channel. Yet again another episode, how to get 50 out of 50 in an exam. This video is all about how to get good grades in your nursing exams, okay? So I'm going to be giving you tips. Your presenter here, IDE Henry, here to take you through and give you the best advice on how you can best get good grades in an exam. Let us quickly dive into it. Don't forget to like and subscribe. You can share the video, drop a comment in the section if you want me to cover a topic. Let's quickly go into it. So how to get 50 out of 50 in an exam. In your nursing care plans, 50 marks. Preoperative and postoperative cares, 50 marks. And lastly, the general management. So let's start with definitions. How do you go about with your definitions? Okay, so in an exam, a definition is 5 marks. A definition is 5 marks, and for you to get those 5 marks, there's some rules that the markers are looking for, some principles that the markers are looking for. So how do we meet those principles? Okay, so here's how we're going to do it. The first thing is give a heading to the term being defined. By that I mean you're going to give your heading or your definition a heading. For example, if you've been asked to define a condition, firstly you give the definition a heading. For example, hemorrhoids, gastritis, peptic ulcer, whichever it is, give it a heading. Then use the rule of 5 to define, meaning what the condition you're defining is, the onset, whether or not it's acute or chronic, the systemic affected or the system affected, whether or not it's respiratory, gastric, a digestive system, cardiovascular and the like, the organ affected, if whether or not it's the stomach, whichever organ of that system, the cause, which can be bacterial, viral, microbial in general, which can be either caused by external factors like trauma, whether or not the cause is idiopathic, include that. And lastly, the characteristics. All this using the rule of 5 is 3 marks and your heading is 2 marks. We proceed, ladies and gentlemen. Mentioning and listing. In an exam, there are parts where you'll be asked to mention and list. So mentioning and listing can range from 10 to 20 marks. When you're mentioning, you're supposed to list brief explanations. You're not explaining in detail. Brief explanations. Listing, you're just going to list them, but you're not going to explain anything, all right? You're not going to explain anything. So that's the difference between the two. Mentioning, you're just going to list and explain a little bit, a brief explanation, and listing means you're just going to list them without explaining. Then, essay questions. This is the big part of it, the big chunk of this video, the most important part. How to ace your essay questions, how to get all the 50 marks to yourself. So a nursing care plan, you'll be asked to identify 5 problems. And the 5 problems that you're going to identify should be correct problems which are relevant to the condition. If you're dealing with a respiratory condition, the problems you identify should be relating to the respiratory condition. So how to write it correctly? The first thing you start with is you identify a problem. Problem identification is 1 mark. Okay? You're going to draw a table on the answer sheets provided and you're going to give it 5 columns. 1 is for problem identified, which is 1 mark. For example, if we're nursing a patient with congestive cardiac failure or pneumonia, check out my video on those. You're going to identify your problem, for example, ineffective airway clearance. Okay, then write a nursing diagnosis. Your nursing diagnosis should contain the problem, its cause, and its manifestations. For example, ineffective airway clearance related to a depressed respiratory center, evidenced by noisy breaths. Okay, so I've stated the problem, its cause, as well as the symptoms or manifestation, and the diagnosis is going to award you 2 marks. Objectives. Objectives should be SMART, ladies and gentlemen. By SMART, S stands for specific, M stands for measurable, A for achievable or attainable, R is for realistic, and T is for time bound. Okay, so for example, our problem was ineffective airway clearance related to a depressed respiratory center. Our goal is going to be the patient will have effective airway clearance within 20 minutes of nursing care. The patient will have effective airway clearance within 20 minutes of nursing care. Always start with the patient. Your statement should always start with the patient. If you write straight ahead to say, to clear the patient's airway you are not being specific. So the patient's airway will be cleared. That's how your objective should be. Then interventions. Interventions are 4 marks, okay? Interventions are 4 marks. And each intervention is going to award you 1 mark. And that should be a sentence. So it should be an intervention and its rationale. For example, I am going to nurse the patient in semi-Fowler's position. Why? The rationale is that we're going to promote lung expansion. How do you express this in full? I will nurse the patient in propped up position to promote lung expansion. You get that one? That's how you do it. And then lastly, evaluation, which is 1 mark. So the English you use in your evaluation should be the same as that in your objectives, except your objectives are in future tense, your evaluation is in past participle, all right, or present tense. So the patient will have effective airway clearance. Then in your evaluation, you write the patient has effective airway clearance, okay? And you include your evidence. The evidence should match what was in the nursing diagnosis. Okay, then we proceed. The other type of essay questions that award 50 marks is that of preoperative and postoperative management, which is in surgery. So if you're a student, a nursing student who does surgery and surgical nursing, this is the right place for you to be. So pre-op management is in 2 types. We've got emergency and elective, okay? So for elective surgery, this is the outline. Epopsin, RPHBV, IPHAP. You can read that in any way you'd like, but these are the arrangement of letters on how your headings should flow, okay? So now, what do they mean? A stands for aims, A is for environment, P is for positioning, O is for observations, P is for psychological care, okay? Your C is for consent from signing, your I is for investigations, N for nutrition, R is for rest and sleep, P is for visit physiotherapy or pre-medication, your H is for hygiene, B is for bowel care, V is for visit by anesthetist, I is for immediate preoperative preparations, P is for physiotherapy, E is for escorting patient to theater, H is for handover to the theater nurse, A is for attending to family needs, and lastly, P stands for preparation of a post-operative bed. That's what these letters mean, ladies and gentlemen. The other type of pre-operative management in surgery is emergency. So the arrangement is slightly different. You start with resuscitation. So you first start with your aims, okay? After stating your aims, then you resuscitate your patient using an A, B, C, D, D, D arrangement. Commonly, people call it A, B, C, D. But here are 2 extra Ds that can give you extra marks in the exam, okay? So the first one is for airway. A stands for airway. B for breathing. C for circulation. D for degree of consciousness. The other D is for deformities. And last D is for drugs, okay? Then you quickly now go to your subsequent management, which is environment, positioning, consent from signing, psychological care, okay? Then you have your cardinal control tests, nutrition, immediate preoperative care, and then we've got your physical preparations, then we've got pre-medication, escorting patient to theater, handover to theater nurse, attending family needs, and lastly, preparation of a post-operative bed. That's how you write your pre-op management. Then we quickly go to post-operative management. What is the outline for post-operative management? Make sure to have these headings around. ASAPOP, new HMIC, okay? ASAPOP, new HMIC. What do these letters stand for? A is for aims. C for collection of patient from theater. E is for environment. P stands for positioning. Your O is for observations. The other P is for pain management. So the first letters I've mentioned, that's A, C, E, P, O, P, is for immediate post-operative care. Then subsequent care we have psychological care, nutrition, exercises, elimination, wound care, infection prevention, hygiene, medication, IEC, and lastly, complications of surgery. Take note, when you're managing a patient from theater, the patient is not going to be nursed in acute bay for the rest of their hospitalization, okay? So you're going to write 2 environments. The first environment is that in your immediate care. Just after the A here, we had our aims, collection, environment. So after this P, you start with environment again, okay? Positioning again. Then you write your psychological care, nutrition, and the rest in that order. Having done that, ladies and gentlemen, Let us now go to the last part of the video, which is the general management. This one is 50 marks. So this management can apply in fundamentals of nursing, medicine and medical nursing, and surgery as well, because there are conditions such as burns which do not require you taking the patient to theater. How do you write the format? This one is split into two categories. We've got medical management and the nursing management. So medical management is 15 marks, nursing management is 35 marks. In your medical management, you're going to write 5 investigations, starting with these headings. History taking, you explain the type of history you're going to take. Physical examination, you explain the types, whether it's going to be inspection, percussion, palpation, and auscultation. And then we've got lab investigations, which can be either full blood count, blood slides, and the like. And lastly, radiological examinations, which can include your x-rays, your CT scans, and your biopsies. Having done that, ladies and gentlemen, the nursing management, the format is that of aprophenema, okay? Aprophenema. I dropped the video. I'm going to drop a video very soon on how to write the nursing management in medicine, okay? So now, points on IEC, 5 points, which is equivalent to 25 marks. It can be 30 marks. It can be 35, okay? Each point should be numbered. Remember, they want 5 points, so each point should be numbered. Secondly, each point should be headed. Then explanations follow, meaning 5 points as a heading, for example, like this. This is your heading, and that's your explanation. That's 5 points on IEC. Your heading is 2 marks. Your explanation is 3 marks. Ladies and gentlemen, we go to diagrams. How do you get your diagrams straight? How do you write them? How do you draw them? How do you label them? And how do you get those marks to yourself? Firstly, you need to give your diagram a heading or a title. That's what I'm claiming for there. Give your diagram a title or a heading, okay? Labels should be on one side of the diagram as illustrated in this picture. They should be on one side of the diagram, okay? At least have not less than 11 labels for whatever diagram you're doing. Not less than 11 labels, and your diagram should be very clean. So start practicing how to draw. Ladies and gentlemen, lest you have any questions, you can leave them in the comment section. Don't forget to like and subscribe. Until next time, see you in my next video.